Good evening and welcome everyone. As you enter the space, we just want to say welcome and thank you for spending this evening with us. We, the ladies of Zeta Phi Beta Sorority Incorporated, Omega Eta Zeta Chapter, welcome you to this amazing event for a much needed discussion during this month of November for Prematurity Awareness Month. Again, as you enter this space, please let us know who you are, where you're joining us from. Remember to keep your mics muted. At this time, we're asking that you keep your cameras off and feel free to use the chat for any questions that you may have coming up during this discussion. Our goal is to keep you on agenda and keep ourselves on agenda as well so that we have a very candid discussion. And remember, this is Rock-a-Bye Baby. With that being said, again, my name is Alicia Queen. I am the president of Zeta Phi Beta Sorority Incorporated, Omega Eta Zeta Chapter. We are currently in Quincy, Mass, serving the South Shore. And on this momentous occasion, we welcome you to Rock-a-Bye Baby. During this discussion this evening, we are observing Prematurity Awareness Month. During this week, just 2 days ago, was Prematurity Awareness Day on November 17th. Our goal for this evening is to have a candid discussion for you all to discuss prematurity awareness, not only what it is and why we discuss it, but understanding the discussion from a very specific viewpoint. With that, with every discussion, we want you to know Zeta Phi Beta Sorority Incorporated holds prematurity near and dear to our hearts. It is one of our initiatives as we partner with March for Babies. Our founders, Arizona Cleaver Stemmons, Pearl and Anil, Myrtletella Faithful, Viola Tower Goings, and Fanny Petty Watts, founded our organization 100 years ago. Yes, 100 years ago. We are still celebrating our centennial. And with that, they have educated communities, lives, international and local, on so many initiatives across the country. And this is one that affects not just local communities, but international levels. This very candid discussion tonight will be held with amazing discussions by women who are going to share their experiences. Our goal is for you to walk away with knowledge about prematurity awareness from the perspective of a parent and medical professionals, for you to understand that you can connect with others, get the tools that you need to benefit the mom and babies and unborn and newborn babies, and learn how you can support moms and babies within your community, not only by sharing this information, by also helping us help March for Babies support the work that they do. Remember, the ground rules is to let every voice be heard, respect the experience of others, and remember to use confidentiality. If you're going to discuss something or raise something in the chat, be sure not to use names, but use those hypotheticals. Again, this discussion is being recorded. It is for educational and informational purposes only. So let's begin our discussion. Tonight, I'm going to introduce to you our moderator. Mrs. Massaquoi King originates from the Lone Star country of Liberia. She became a member of Zeta Phi Beta Sorority Incorporated on November 20th, 2016 for the Omega Eta Zeta chapter of Zeta Phi Beta Sorority Incorporated. She graduated with her bachelor's from the University of UMass Dartmouth in poli-sci with a pre-law concentration, and she currently also holds her Juris Doctorate degree from the Massachusetts School of Law. She currently is a senior litigation paralegal for an insurance defense firm, and she aspires to one day hold judgeship for the federal court, as well as looks forward to launching her own nonprofit organization to cater to the rehabilitation of human trafficked victims. With that being said, I'm going to remove myself out of the way right now and put you in the very capable hands of our moderator, who is also the secretary for our chapter, the Omega Eta Zeta chapter. So, Sora Massaquoi King, the floor is yours. Please introduce our panel.
Hello, everyone. I am Moss Masquoi King, and I will be your moderator for the evening. I will say that you all are in for a treat. We have a panel of amazing and talented women. So, without further ado, let's go ahead and jump right in. Um, we have Dr. Janet Williams. Just to give you a little background about Dr. Williams, she received her doctorate of nursing practice in 2019 from Wilkes University and master's in midwifery from SUNY Downstate. She has been a board certified nurse midwife and a collaborative hospital practice for about 17 years. After attending over 500 births, she still continues to be in awe of the strength of the women that she serves. She is the founder and CEO of Transitions Women's Health Consulting LLC, where she's a consultant and a source of information for patients and healthcare providers. She is a course creator whose vision is to decrease the maternal mortality and health inequities of women of color, and through um, health and wellness education, sharing information with providers, and career mentoring to create an ongoing pipeline for minority birth workers. That's not all. She holds a faculty appointment as a clinical instructor for graduate midwifery students from Columbia University. She is a member of the American College of Nurse Midwives and NYC Midwives. She has a heart for adolescents. In fact, her doctoral study was entitled Dreams Matter, Future Goal Setting and Contraceptive Intent in Adolescent Females. It is her belief that if women are supported throughout their life cycle, it will positively affect the entire family. She has also published a national health guide on preconception care and presents annually to students about healthcare, midwifery as a career, and she is a speaker of the Bureau of Brooklyn Queens Long Island Area Health Education Center, and she has served on the board since 2011. It's pretty much a nonprofit organization whose mission is to improve healthcare outcomes in underserved areas through development of education, mentoring, and training programs to increase the pool of skilled providers. She is also a volunteer um, for Mentoring in Medicines, whose mission is to recruit more young people to the field of medicine and other healthcare professions. So, when I said that you all were in for a treat, I meant what I said. Let's give Dr. Janet Williams a virtual welcome, or round of applause, I should say. Welcome, Dr. Williams. Thank you so much for joining us. Next on our panel, Next on our panel, we have our very own Sora Shenaya Martin-Johnson. Sora Johnson obtained her bachelor's degree in social work at Bridgewater State University back in 2013, and she obtained her master's degree in social work with a concentration in children, youth, and families with a specialization in management at the George Warren Brown School of Social Work. She became a proud member of Zeta Phi Beta Sorority Incorporated, woo woo, Spring 16 with Phi Nu Zeta Graduate Chapter in Missouri. She served as the community service Z Hope Chairwoman from 2016 to 2018. Sora Johnson then transferred to the opulent and elegant Omega Eta Zeta Chapter of Zeta Phi Beta Sorority Incorporated, where she served as a Z Hope coordinator from 2018 to 2019. She has helped fundraise and donate items to the March of Dimes and local NICU for March of Dimes. Um, it is unfortunate, however, very rewarding that Sora Johnson now gives back to the March of Dimes as she has joined the community beyond volunteering, but now through her own life experiences. She is a mother to a 2-month-old premature baby boy named Logic. Logic was born on August 11th at 30 weeks and 1 day gestational. He weighed about 2 pounds, 13.7 ounces, and he was in length 14.9 inches. Um, Logic spent about 43 days in the NICU. He's now home with his parents, thriving and weighing over 6 pounds. Logic is Sora Johnson's second pregnancy and premature labor experience. She gave birth to twins, a boy and a girl, at 18 weeks gestational last October, who unfortunately passed during and after labor. It's unknown why Sora Johnson had two premature labors, but she believes her illnesses may play a big factor in why she experienced the two premature labors. Sora Johnson is surviving with several chronic illnesses, which she will get into a little bit later. Sir Johnson, I just want to say how sorry I am about the loss that you and your family experienced earlier in the year. I also want to just thank you for being a voice and advocating for women who share a similar experience, but just may not be at that point to vocalize their experience. So thank you so much for joining us.
Thank you. Thank you.
Last but certainly not least, we have Miss Talethia Edwards. Miss Edwards is a mother of 9 children, a doula, an advocate, and community mother and change maker. She became interested in birth work as she journeyed through her own 7 pregnancies, all unmedicated births. All unmedicated births, 7 pregnancies. Okay. She experienced her first she experienced her firsthand experience of labor support, where she had to advocate for herself. Um, she learned that in order to protect her labor and deliver, um, and to allow her body to pretty much go through the process the way it was designed to go through, she would need to pretty much fight the healthcare system, which regularly ignores Black women. Miss Edwards has assisted in over a dozen births outside of her own and finds pure joy when she's assisting family and having the birth experience that they wish for. Miss Edwards knew that birth work was what she was called to do, so she started her own business. It's called the Flower Pot Doula and Vaginal Steaming, where she provides contraception, pregnancy, and postpartum doula services. Being a Black woman and understanding culturally that sex and sexuality was stigmatized and taboo among women and communities of color, she wanted to destigmatize the uterus and conversation of self-care and added Yoni Steam practitioner to her tool bag. She is overall passionate about women's health and birth work. Um, the Flower Pot also offers birth preparation, childbirth, and breastfeeding education. So thank you, Miss Talethia Edwards, for joining us tonight. All right, so before we start, I just want to ask the panelists to bear with me. I am not a mom, and I have not embarked on that journey yet. So if you do say something and I ask you to simplify a little bit, it's because it's still very new to me, and I'm probably representing that demographic of moms and women and probably even men who too are not parents. So bear with me, okay? Dr. J, I'd like to start with you. Can you tell me what Black maternal health is, and can you identify the various stages of maternal health? Oh, Dr. J, we can't hear you.
Sorry, I had to unmute. Okay. Black maternal health is basically the optimal level of health and wellness possible in women of color during their childbearing years. It encompasses preconception care and preparation of a pregnancy, prenatal, which is the care that's given during pregnancy, intrapartum during delivery, and postpartum, which is afterwards. In caring for the whole woman, we have to explore like all of her health history and ensure that she's in the stablest health possible at all times, because approximately 48% of pregnancies are not planned. So in that case, unplanned does not mean unwanted, but you can see why it's so important for women to be in the healthiest state possible at all times. If they have a chronic illness such as diabetes, thyroid problem, hypertension, those should be controlled, and all medications should be discussed in case a pregnancy comes up at that point. And there are certain medications that shouldn't be given unless a woman is on like a good birth control method to prevent pregnancy, because certain things can cause birth defects. So when you talk about maternal health, you can kind of encompass in that whole arena there.
Okay. Now, Dr. J, the CDC reports that pregnancy-related deaths for Black women is 3 to 4 times higher than those of white women. Why is that?
Well, that is a multifactorial kind of question. We know that poverty can cause problems with maternal health and mortality rates, but that's across the board for everyone. That's white women or Black women. But what we find is that when we increase the poverty, when we increase the level of less poverty across the board, white women do better. But when you increase the annual income and the education of a Black woman, we don't do better. So it has to be something else. We have to look at racism. We have to look at stress. There's other factors that are involved here that we have to look at.
Okay. Sir Johnson, what are some red flags that Black women should be aware of when they are in hospitals during prenatal care and up until their delivery?
For me, I would say it's when you're asking for the treatment. So, like Dr. Williams was saying, I have multiple conditions, like health conditions. And so, for me, a red flag would be if I'm asking the doctor to do more testing because I have multiple sclerosis or scleroderma and they're refusing that. It kind of prevents you from getting the care that you need because you have this condition and there may be other treatments that you need, but they're refusing it. So because you're not getting that treatment, it can affect the pregnancy with the child.
Okay, and that must be very frustrating, especially when your primary care or your OBGYN is not advocating for you. So what is the next step if you ask your PCP or your OBGYN to run those additional tests and they're not doing that? Like, what is the next step?
That's a great question. For me, I was an advocate. I have a bachelor's degree in social work, so I was always advocating for myself. But I would say for someone who struggles with advocating for themselves, who definitely reach out to a doula. They're there to support the parents. That there's a lot of support around the baby, but there's not a lot of support for the parents, especially the mother. So if you find a doula, they can help support you. They advocate for you as much as they know, especially the hospital. Some doulas are very familiar with the hospitals and the doctors, so they know how they operate. They know the resources around you, so they can help you get the resources you need while you're pregnant, especially before delivery, because the whole goal is to have a successful delivery. But if you don't get the services you need, you may end up with a premature labor like I did.
And can you tell us about your experience when you were birthing your son in the hospital? Did you feel safe? Did you feel like they were giving you the support and care that you needed at the time? What was that like?
I was fortunate enough to be placed in a hospital that was very supportive. It was ironic that I had recently moved out of the Boston area. And so when I went into premature labor, I was in a new city, Worcester, Massachusetts, and they happened to have a great support system there in their L&D department as well as the NICU. L&D as in labor and delivery department, and then the NICU department. So that experience for me was actually helpful because, again, I'm somebody who always gives the support. So the nurses kept asking me, what can they do for me? But I didn't know how to ask for support. So I remember asking a nurse, like, what do you mean? What can you give me? I don't know what to ask for. And she said, back rubs, drinks, snacks, more information on the procedure. Do I feel any pain? Do I need medicine? Just let her know, and she would provide as much as she can, or she'll get the doctors. But for my experience with my twins, I was in the Boston area, and for me, that hospital, I feel like everything was being rushed. And at that time, that's when I really feel like I wish I had a doula. I never had the experience of having a doula, but I wish I did when I had the twins, because I feel like when I went into the hospital, it was just quick. They wanted me to make a decision on everything so fast. I hadn't even been here for 24 hours and it was like termination and like delivery and then go home. And I'm like, no, like, what can we do? There's still a heartbeat, you know, but I was just a young girl who didn't know too much. So I just called my family. My aunt reached out. She knew the doctor because they worked at the same clinic. So I had her talk to them, but I would definitely say that my experience with my son was better than my experience with the twins. So it really depends on the hospital that you are at as well. So do your research on that. They do allow you to go in beforehand to see what the labor and delivery department's like. If you know that you might be going to premature labor soon, I would check out the NICU as well. My son was in a NICU that had a NICU cam. So every night my husband and I was able to watch him when we wasn't there. So that was good. The nurses left notes on the camera for us. So we felt like we was involved in the care for him.
And now we throw around the term NICU. Can you just define that just in case there's viewers who aren't sure what a NICU is?
I'm sorry, it's the neonatal intensive care unit. So that's for babies who are born premature and suffering with severe conditions.
Thank you. Talethia, so due to African-American women making up the largest demographic of maternal mortality, what can doulas provide during delivery that hospitals cannot?
Well, if I could just add a little bit to Neymar's story, I also experienced premature birth, but as a healthy woman would know, I was 23 when I had my first son. No underlying health issues, but it started. I had read all the books by the time I was 18 weeks and was telling my doctor at the time that I was experiencing, like, I think I'm losing my mucus plug. And he was like, "You're young. You can't be losing your mucus plug," as if preterm labor doesn't exist. So I was ignored. I went into labor at 24 weeks. Literally kept feeling what I call tightening. Like, you never had a baby before. You don't know what contractions feel like. I'm sure Neymar with the twins, you probably like, what is this? And went to the hospital, just not trying to scare my family or anybody. I said, I'm going to take a ride. Went to the doctor, went to the hospital. I'm in full blown active labor, 4 centimeters dilated, 24 weeks, um, pregnant, and ended up spending 8 days on the labor and delivery floor before they were able to stop the labor and send me to the antepartum floor. But it is so important to just to really know the signs that you don't have to have underlying health issues to have premature birth, that you can be a healthy woman and premature labor can actually happen. And so being an advocate for yourself is so important. So I definitely wanted to add to that experience. But what can a doula do? A doula purpose is to support the birthing person there through physical, emotional, and informational support. Our purpose is to advocate for the patient by informing them, right? So a doula technically is not supposed to speak for that birthing parent, but empower them to speak for themselves, to ask the question, okay, Neymar, they're asking you to make this decision right now. Are you ready to make that decision? Do you need more time? Like, allow you to say that because maybe you're trusting them at the moment you walk in, you're in a crisis. And so you're trusting a medical professional to make the best decision for you, but it is feeling like I'm not even ready to make that decision. So in a doula helps the birthing person feel empowered to say, I'm not ready yet. Let me get some time to think about it. Can you give me more information on that procedure? And that's in a crisis situation. But in a normal, healthy birth, we're providing comfort measures, right? Not only to the birthing person, but to the family, right? There may be a father who needs to take a break or a birth partner who needs to take a break. And that doula is there, making sure that you're there to support, but that you are always in this kind of concert, that it is constructive support, that you're not isolating that other support that's being bought there.
Okay, so in a hospital, is there like a max of how many people can be in the room? Do you get like pushback from like the providers, the doula? Do they only say like, hey, we kind of just want it to be like the mom and the partner spouse? How does that work?
Where in Tallahassee at the Women's Pavilion, you can have up to 5 people. Any
Okay.
5 people you choose, you can have 5 people in that room. Capital Regional, from what I understand, I think they have that same number of people. You can bring in 5 people. Once the dad gets the band or the partner gets the band, then they no longer count in your 5 people. So your doula can be a part of it. All of that has changed since COVID. So at first they were excluding even the partners out of the room with the birthing moms, which I found so dangerous. And now they've allowed one extra person, and birthing persons are having to choose between their doula and their partner or spouse. And I don't think that that should ever be a choice in birth, which is one of the most wonderful and traumatic situations at any time. People would not, associate the word traumatic with birth, but so much happens during birth that it can be a traumatic experience if you don't have that birth experience that you're looking for. So each hospital is different. I was present for my sister who gave birth in Albany at Phoebe Hospital, and I immediately knew that that hospital was not supportive of other people being in the room. That they had a high rate of cesareans because they did nothing to provide comfort measures, knowing she was trying to have a natural birth. And so I stopped the nurse immediately. I said, "What's your cesarean rate here?" It was 92%. 92% of
92.
tell me 92% of women walking in that hospital need cesareans. And so I could tell just by how they were treating her, that they were not used to women wanting to have a natural birth and patient with her. So each hospital is very different. So Neymar said it, do your research, visit the hospital, talk to the L&D staff, you know, ask your doctors about their experience, interview other moms who may have birthed there. That is definitely important.
Okay. So can you tell me what the common setting looks like when using a doula for delivery support? Like, are there tools, a pool? Is there like white noise in the background? Like, what's going on?
Well, I think it's to each his own, right? So each mother wants something different. I've been like you read in my bio, I've been involved in over 12 births outside of my own births, and each mother is different. Some want the aromatherapy; they don't mind the smells. Then you have another mother, no smells. You can't even go and take a coffee break and come back. That will totally upset them. Some moms want dim lights, dimly lit rooms. Believe it or not, I had one mom recently. She wanted trap music, craziest thing I ever heard. But listen, that was her birth, and she wanted to turn up and kind of move through her contractions, and it put her in a zone. And so it
Yeah.
is about what makes that mother, that birthing person, comfortable in that particular time and in that space. I had one mom. I was so uncomfortable, but she was very comfortable. She was literally like all the way to the edge of the bed, and she was kind of hanging off, and her legs were crossed one side of mine, and she had this really intense hum, but it put her in a space that made her gave her the ability to labor in a way where she was comfortable and deliver how she wanted. And so each space is different. When you ask about the tub, most hospitals now have the whirlpool tubs. Most hospitals will tell you no babies in the tub. Dr. J, you probably heard it so many times, no babies in the tub. But if a baby coming while you're in the water, they're not going to stop you, right? Uh, you, you see the birthing pools typically at home birth. So I have two sisters that are pregnant right now, and they're choosing home births, and we're looking at the pools, and we're looking at all of the materials we want to use, and we may use none of them, right? Because you don't know how birth is going to go, but it can look so different for each woman what's in that room.
Okay. Dr. Jade, so to reduce maternal mortality rates, what services do you think should be provided during maternal health?
There's a variety of different services that need to be provided. Many women need supportive services in addition to their physician, midwife, or doula. Some women need pelvic floor physical therapy before the birth and after. During pregnancy, they're having a lot of pain in their pelvis or their back or their hips. Those women, if we can get them some help before to make them more comfortable, and also it helps them identify that pain from pain, for instance, going into premature labor. If you're in pain all the time, how do you know the difference? So we need to try to, it's not too many times women are told you're pregnant, you're going to have aches and pains, which you're going to have some, but there's some things that we need to do to try to rectify or to seek out and make sure there's nothing else going on. The other thing is after delivery, they may need some help getting their pelvic floor strong again. They may need a nutritionist to help them with their diet. They may have diabetes. They may be obese. We have a lot of women who have history of depression, sexual abuse, trauma, post-traumatic stress disorders, and they may need support during the pregnancy. It's a very time of high stress, high hormone levels, and they're at higher risk for postpartum depression, which women can get after the delivery. So we have talk therapists that we can refer patients to, or social workers during the pregnancy, just to give them that support. We also have lactation consultants for moms that are having trouble breastfeeding. You have childbirth educators. Most of the doulas do childbirth education with their women and families. However, you have some that don't. So, you have some postpartum doulas that don't even do birth. They just do postpartum. So you have people that do just childbirth education. And then sometimes women need referral to other doctors. They can be with a doctor or midwife, and we either collaborate or we refer. If you have a patient with a seizure disorder, they may need to be seen by a neurologist. Or someone with asthma, they may need to see a pulmonologist if they're not under control. So there are a lot of different referrals that may need to be made. There are referrals sometimes when they do a sonogram, they find out the baby has a cardiac condition, and this hospital may not have a cardiac surgeon to do surgery at birth. So that mother may need to be transferred the entire care to a hospital that would have that high level of care. And those are the kind of things that need to be looked at during the pregnancy, and those are the kind of things that can cause maternal mortality and infant mortality if it's not addressed properly. The mother needs to be in the right place, in the right setting, with the right provider, with the right services all the time. So we have to just keep an ongoing, dialogue to see what's going on with her.
Now that is a lot. Just taking that in for me. So, so you have, let's say you have an expectant mother in your office, and you told what you just told me. Like, what is like a plan that, she can have just to step by step, like
Okay.
she needs some therapies. Like, where does she go from there? Because like you telling me that, I'm just kind of like, whoa.
I'm telling you a lot. Okay. First of all, I just want to kind of backtrack a little bit. When you were talking about red flags from the beginning, like what are the red flags? My biggest red flag is a provider not listening to you. Okay, it's all right to ask for feedback, and this goes from the first time you walk in their office, okay? So it's important, first of all, to start prenatal care, I would say, in the first trimester. As soon as you find out you're pregnant, try to start prenatal care, because you want to have time to interview your provider. You don't want to walk in and just, I'm this many weeks pregnant and I need to be seen now, and you're just kind of rushing. You want time to interview them, to find out who they are. Are they going according to what your wishes are as far as what you're looking for in a birth experience? And if they're not, then you find another provider that clicks with you. You don't stay with a provider that doesn't. So it's the red flag for me is making sure that person is listening to you, finding out if you're leaving the appointments with unanswered questions. Every time you leave, you have unanswered questions, or you have a provider that becomes upset if you don't go along with everything that they order, every test that they order, and you're asking questions and you're not getting the answers that you need to make an informed decision. When we offer you your prenatal test, there's a battery of routine tests that are authored, okay? And they'll say, do I have to have that? And I'll say, you are in charge of this. I'm telling you what's available and what each test shows, and you get to choose. It's a conversation. It should be an ongoing conversation back and forth all the time with the patient. And if you're not getting that, then that's not the right provider for you. So, I think that's the biggest thing. And it should be a conversation of what to expect for the pregnancy. A good history, going through your whole history. That preconception thing is so important in that first prenatal visit, where we go through your whole health history, your surgical history, we go through your family history, allergies, everything. That's when we're looking at what we call risk assessment. That's where I could say, okay, this person is a young, healthy young woman. She's had no surgery. She has no diagnosis that would preclude her from, say, having a home birth or having, different things that she might want. Some people can't have all of that. They can't because of their history. If they've had 2 C-sections in the past, that's not somebody I would say you're going to go home and have a delivery at home. I wouldn't feel comfortable with that. Some women do feel comfortable with that. But personally, that to me is a little high risk there, Or if someone has a medical problem that they can't have certain things, or, those are conversations you have. But you can only have those after you've had that conversation and the risk assessment with that patient. And then you can talk about what they can expect, and you can talk about birth plans and birth options and where they can deliver and with whom, what provider they need, that kind of thing.
Okay, so you mentioned prenatal visits, right? So you have a PCP, you find out like, oh, okay, I'm with child. So how do you go about selecting an OB? Like, how does that work? Is that something that your PCP will refer you to, or does the expectant mom take it upon herself to kind of navigate an OB for herself?
Well, where I work, all of the midwives, we see all of the patients that come in new pregnancies. We see everybody, and we have 17 midwives where I am. We take care of all the women. Our hands are in every pot there. But we may collaborate with the doctors, you know, for some of the patients that have medical problems. Oh, something just popped up on my screen. Okay. Certain patients may have medical problems. We're going to collaborate with the doctor. We may do joint care. Some patients get transferred to the doctor for full care. But when it comes time for delivery, we deliver about 80% of the normal delivery. Even for patients that have medical problems, we still do the delivery. So they still get the benefit of midwifery care, like collaborative care. A lot of women get referrals from their friends and family. I get a lot of patients from my patients that I've delivered previously. There are websites and programs that you can look at. There's one called In Her Hue. It's an app you can download. It's all Black providers all over the country. You can look people up online now. There's different, if you look up a name of someone, you can see their ratings, and different hospitals have different C-section rates. As you heard, somebody, I think she said 92%. I've never heard one quite that high. That's scary. But there's different ways to look for that, you know, look for a provider. And it depends what you want. It depends. Some women want a doctor to be their provider. Others are saying, I want a midwife and a doula. It depends, you know, but, you know, word of mouth, I think, and, you know, you can get it from your PCP can maybe offer, you know, if they have partners that they work with, they can give you names also. But in the end, it's up to you to go in, and I call it unmute, where you feel comfortable speak. You have to feel comfortable speaking up for yourself. And I know you have your doula there, but that's the biggest thing that I tell my women. I said, you have to learn to unmute. Everyone on the birth team needs to remind the women to do that. The doula, the midwife, the doctor, everyone. That mom's voice is the most important voice in that team.
Can I piggyback off of that? I agree with her. I really think that you have to take the time to learn about your pregnancy. I even encourage people who aren't pregnant right now but plan to have children in the future. Like, look into the OB doctors now. I went with my general OB that I use for like woman exams in general, and she was already a labor and delivery OB as well, so she was able to explain things to me. She had recently had a child of her own last year when I was pregnant with my twin, so it was good for her to explain to me through her life experience, but also her medical book smarts experience too. And because she was already my OB, she was familiar with some of the conditions I already had. And I think Dr. Williams talked a little bit about how you want to have a team of people. So my support team was my doctors. My PCP talked to my OB. My OB talked to my rheumatologist doctor. My rheumatologist doctor talked to the neurologist. It was a team of people. They were trying to figure out what's going to work best. But I feel like one of the things that may have been a problem, or somewhere I could have probably prevented my second premature labor, was the aftermath. So when I had that first premature labor, there wasn't a lot of research with the doctors. They didn't really know what happened, and they sent the placentas to the pathologist, but I didn't get to really sit down and talk to them in depth about what happened and try to figure out. So if I got pregnant again, what can we do? So we talked a little bit about resting your body and making sure that you stay on this kind of medication, that medication, but it wasn't enough research and study on if you get pregnant again, what can we do? And when I'm talking about that, I'm thinking about when I had my second pregnancy, I feel like maybe they should have introduced progesterone or a cerclage earlier on. A cerclage is a procedure that helps stitch up your uterus so you won't go into premature labor. So if I was somebody who already had that experience in the past, that's something that should have been offered to me by the 12th weeks of my pregnancy. So that's something that the doctors really want to offer you by your 12th week. But I went past the 12 weeks. I thought this pregnancy was going to be different. The doctors are telling me, you're having a singleton baby, which means you're only having one. This is going to be better than the twins, which can be insulting to me. Like, I wanted to carry my twins for a term, but I didn't. Okay, but don't just tell me, hey, be happy. You only have one this time, so it's going to be a better outcome. No, we should have talked more about what was my options to keep this baby in. But I am grateful my child is alive now, but that's just something I think that you want to consider. Just make sure that you're out there and you're talking to your doctors. And it is also okay to say no. Doctors are humans just like us. Nobody has actually mastered everything. We all are winging it in life. So don't feel like you can't say no to the doctors. When went into my premature labor with my twins, my water ruptured, the membrane ruptured with my boy. He was coming out first. So when I got to the doctors and they did an ultrasound, the lady was kept telling me, oh, the baby's not alive, there's no heartbeat, so we should go ahead and abort both babies. And so my husband and I was like, we haven't even been here for an hour yet. And I kid you not, I went in the ambulance and everything. My husband got off work before me. I mean, my husband got off work before the ambulance got to the house. It was like everything just seemed like it was moving in slow motion. But by the time we got into the emergency room, the doctors was like, make a decision, make a decision. And I'm like, no, wait, we need to take some time, especially if there's still a heartbeat for one baby. But then also they kept telling us that they had better machines, that the machine in the emergency room wasn't as accurate. So to us, we're saying, well, maybe there is a heartbeat for both babies. I don't want to just terminate both yet. Can we go and do another exam? And they're like, oh, well, let's just wait it out. But they really wanted me to make the decision to abort both babies. But I said, no, I'm going to go with this option. They will press on you with infections. You're going to have an infection. You're going to have an infection. Don't do it. But at the end of the day, it's still up to you. If you want to take that risk, go ahead and take that risk. It's really up to you. It's your life. Because sometimes we get drained in, well, they're the doctors, they know the best. But I know someone who has the same thing. She had her water rupture at 18 weeks. They told her to abort the baby. She did not. She went home. Her daughter's 3 years old now. If she would have aborted that baby, she wouldn't have had a 3-year-old right now. So sometimes you got to go with your gut and make the decisions that you want.
That's right. I would like to add to that. We're talking about making a decision. So my first birth, I had an OB, and after going into premature labor, I did not trust not being listened to, and I didn't like switching the OBs because it was a practice, right? So I didn't like that I didn't see the same person, or I had to talk to whoever was on call who may not have known me. So I went with a midwife the next time, and I'm so grateful that I did go with a midwife because she delivered all of my children after that, and she got to know me. She learned my body. My early labor is really long. 3 days is normal for me with an early labor, with early labor. So she would say, "Okay, what are we gonna do? We gonna break the water?" I'm like, "Nah, I want to go.
Yeah.
You know, I'm gonna go somewhere, so I'll come back. You know, in 2 days or whatever." That's what I would do. And she knew that, but she knew once that water broke, I was gonna go really quickly. And so I think that it's being empowered and being with someone who empowers you to do exactly what you know that your body can actually do. I remember my sixth child, my midwife told the nurse, she said she goes really fast, like trust her word when she tell you what's going on. I'm gonna go take a nap. So I'm literally in there. I remember asking them, like, go ahead and admit me because I want to watch Scandal. Like I wanted to see Scandal before I got in active labor. So don't break my water until after Scandal goes off. So she broke my water and she tells the nurse, I'm gonna go take a nap. She typically goes really fast, but she's not new to this. Like, trust what she says. I'm telling the nurse, I'm laboring no pain medicine, and I'm saying I'm pushing. Like I feel myself pushing. And the nurse tells me, it's no way I could be pushing right now. Like I
Okay.
haven't been there that long. It's my sixth child. Like really?
I
So
know.
listen, I literally, y'all, I'm telling this story because this stuff happens. Oh, it's no way. It's no way. I get in that bed and I know I did this before. And I look at my mother-in-law and I tell her, I'm about to have this baby.
Mhm.
And she's telling me, don't do it. Wait on the doctor. Absolutely not. I delivered that baby by myself. That
Oh.
video is used right now in like the doula classes here
Oh,
because number one is to show trust the mother. She knows, right?
Right.
She's feeling every single thing. And number two, it is affirmation for the woman. Trust yourself. I'm saying it doesn't matter that I've been here a short time. I feel that I'm bearing down with this
Mhm.
baby or whatever, but when I think about Neymar, similar story with a friend who lives all the way in Arizona. She knows I'm a birth advocate. She went in and she was in preterm labor 13 weeks, much less than you. And they were telling her abort. Like you're gonna lose this baby. So we need to do a DNC. And she kept asking, show me a heartbeat, show me a heartbeat. If there's no heartbeat, I'll move forward. They didn't want to give her an ultrasound. She called me on the phone. This is how they do Black women, y'all. We talk about premature birth and and Black maternal health. This is how they do us. So she calls me and she's saying, Talethia, I'm in the hospital. I'm in labor. I'm 13 weeks. These are my contractions. And they're telling me to do a DNC, but they won't show me whether or not my baby has a heartbeat. And I said, put me on the speakerphone. And she put me on the speakerphone, and I asked that doctor, I say, listen, you are going to verify viability of life right now. And if you have viability of life, you're going to give her a cyclosh. You're going to let her body do what it does. Because if the baby's going to pass, then it's going to pass, and we got to deal with that. But if we got a heartbeat, your job right now is to preserve life. That's your job right now. And that doctor was so upset that she called me, but guess what? That child is 4.
Oh.
That baby is 4 years old. And she carried that baby to 38 weeks with that cyclage. And I'm telling you, it just sometimes takes for somebody to hear you. I'm all the way in Florida. She's in Arizona. And she had people, medical providers in her space. Like when I tell that story, people think I'm lying, but it's a true story. She can tell it. That they would not show her. They wouldn't ultrasound her and show her. What they would have just done a DNC on this woman with a live baby. If she said, I just feel my baby is alive. I just feel it's alive. Like they need to help me. And so they were so upset when they got ready to do her cyclosh, because you up there and we're women and all this stuff going on in our bodies. And one of the ladies said to her, like, oh, you need to take a shower. Honey, I would have filed a lawsuit so fast. But these are the things that they do to Black women, and we have to have somebody in that room. Our husbands don't always know. My sister gave birth to twins, and I walked into the room and she was scratching, like furiously scratching. And I was like, what's wrong? It's like, I'm itching. And I said, how long have you been itching? She's like, since I was downstairs. And I said, who did you tell? She's like, I told the nurse. I told him downstairs, and I told him when I got up here. 2 seconds. I call a nurse in here. I said, ma'am, did she tell you she was itching? Oh yeah, it's just a side effect of the epidural. Yeah, but you have antihistamine. Give her to block that, right? Exactly. So go get her antihistamine and bring me some lotion so I can rub her body down. Why would you have her suffer like that? She's like literally, she's making her body red because she's itching. But you're denying her. That's a part of this whole Black maternal health awareness and this implicit bias and stereotyping and discrimination that is happening to us. They do us like that and they ignore us, and it is causing us our lives, and we need people in the room with us, even if it's not a doula. I'm advocating that every Medicaid provider pays for doulas, because everybody deserves, regardless of socioeconomic status, deserves to have birth support. Young girls who mama haven't got on board yet deserve to have birth support. Like I have 4 daughters of my own, and I have a 13-year-old, and I talk to her all the time about preconception health and her reproductive systems and all of these things, but they need help. Girls are having babies as teenagers, and they are dying as well because we mad they got pregnant. If they're gonna be pregnant and have a baby, we gotta support them. So I get so passionate when I talk about this. And I was gonna ask you, Neymar, I assume you didn't have a cyclosh. I knew when you said you had a second premature labor and birth that you didn't have a cyclosh. And my thought is, why not? The service is still the service. It opens the same, one singleton or twins, like that would have been the first thing. So I think that, you are educated and empowered now to ask those questions, but doctors should also inform us as well. They have a duty as well.
Okay, so I'm gonna have to put a pin because you guys threw around some terms that, of course, myself and my represented demographics, we may not know. First thing, what is a cyclage?
Dr. J, you gonna take that?
Yeah, I'll take that. The cyclage is a stitch in the cervix to help hold the cervix closed. Okay, I just want to clarify one thing with the cyclage. A cerclage is used if a mom has had a previous loss and the cervix opens, usually painless contractions. That's when a mom comes in the hospital, she's not having contractions, and we just by accident, you feel and you find out that the cervix is either very short or it's open. If she came in with contractions, contractions, then that's different. That's always not a indication for a cerclage. If you're contracting, then they can't put the cerclage in because it's actually, that's a mechanical opening of the cervix. It's when it's that painless opening or the cervix is short on sonogram. That's when they do it. Or the previous pregnancy they had that opening. So
I should have clarified that they had to stop the contractions before they could get a cerclage. I should have clarified.
Correct.
Yeah. Sorry.
Okay.
And for me, it was the cerclage because my cervix was shortening. And correct me if I'm wrong, Dr. Williams. If it gets into the one, this is what my doctor told me. Your cervix should measure out for at least 3 centimeters, but mine was measuring out. It got down to 1.9, and she had said if it gets into ones, that's kind of more at risk of premature labor. So I had that appointment on Monday, and it measured for 1.9. And then by Saturday, that's when I started seeing some bleeding and ended up in the emergency room going into premature labor.
Yeah.
Okay. Now the next clarification that I need is a DNC. What is a DNC?
DNC is when they go in the uterus and they scrape the contents out, basically, to empty the uterus out.
Okay. Last clarification, I believe it was Sarah Johnson mentioned water rupture.
The water ruptured, you said?
She said something about a water rupture.
The membrane rupture. So that's when people say like my water broke, that's the membrane. But I like Dr. Williams explain more in medical terms.
Okay. So a rupture of membranes is when the amniotic fluid, which the baby is floating in, that ruptures. Once that ruptures, then there's basically an opening towards the baby. So that's when we start to be concerned about infection. But we're talking about over a long period of time, not in a few hours. Okay. So and women break their water. That's one of the things that happen as far as education. A lot of times women come in and you find out that they've been feeling a little damp for the last few days and they broke their water 4 days ago. But they didn't really know enough or feel comfortable to say that they thought their water broke. They're like not sure, so they didn't say anything. And those are the women, again, that we tell them to speak up. If you have to come to the hospital every day because you think something's going on, then you come every day. I'd rather see you, make sure everything is okay, and send you home and say, okay, see you later. It's nothing, but come again if you think anything is going on. It's very important that we listen. And women, if they came in a few times for something and it was nothing, a lot of times they feel ashamed or scared or anxious to come back in. But we have to tell women, you know your body better than anybody else, okay? And you need to come and talk to us and tell us. We would much rather do testing and say it's nothing than for you to stay home and it is something.
Okay. Now, I just want to take a brief pause and just check in with the team and see if there are any questions that were placed throughout the chat box.
Yes, we have some questions. I tried to document them as much as I could. So let me see if I can. So for a pregnant woman, even with no pre-existing conditions, are doctors recommending strategies to lessen the chance of premature birth, such as diet, exercise, and etc.?
I'll start to answer that. Basically, women are encouraged to stay and remain as healthy as possible. That means exercise, and that means a good diet. Also, we talk to women about pregnancy spacing. If she just had a baby, we try to get her to wait at least 12 months to get pregnant again, to let her body build back up. If she's anemic, to let her iron stores build back up. Patients that have pre-existing illnesses such as diabetes. If you have a woman who's diabetic and she's not in good control, that mom can have something called polyhydramnios, which is an increased amount of water around the baby. Anytime the uterus is over distended, that it puts you at risk for preterm labor and a preterm delivery also. So also a diabetic mom who is not well controlled, her baby is growing larger than it should because there's too much glucose circulating around in her body, in the blood. So that baby that's larger, again, is over distending the uterus, which can increase her risk of having a premature labor. So there are certain things that if we can get her stabilized and under control, like the diabetes, for instance. And if if they do pregnancy spacing, there are certain things that can lower her risk a little bit.
Okay. And while you are discussing, you discussed a little bit about an app for I guess mothers can look about the health in the hue or health hue. Can you?
It's called In Her Hue, and it has all doctors and health professionals in all different areas all over the country. You can download it right on your phone.
Okay. So you for those who had that in the chat, you have the app. And Talethia, someone asked about what is yoni steaming. So you talked a little bit about yoni steaming. So they want to know the pros and benefits or the cons of yoni steaming, and what are some misconceptions of yoni steaming.
Well, sure. Yoni steaming is a vaginal steaming. That's why I use the proper term in my business name, vaginal steaming. It is the benefits of using herbs and steam to increase vaginal and uterine health and wellness. One of the misconceptions about it, one is that maybe it's just like a luxury. I have found it. I don't practice as a healer. Like some women practice yoni steaming to heal endometriosis, fibroids, prolonged menstruations, and different things like that. The reason I started, I've seen all the benefits. My sister couldn't get pregnant. She tried to get pregnant for 3 years. We started steaming her every day outside of her cycle. She got pregnant. There's increased blood flow. I'm trying to talk fast because I know we're moving, but it helps with increased blood flow to the uterus. You may have dryness. It can increase the moisture down in the vaginal area for women who are married or who have a consistent partner having unprotected sex. There's mucus buildup on the uterus that in the inside that we don't pay attention to. We've been taught that our menstrual cycles cleanse everything that's in there, and it does its job, right? And it works. But we aren't taught about uterine stagnation. I had my babies back to back. Uterine fatigue, stagnation. I didn't properly baby space, Dr. J. I had all my babies back. And and also, so as I'm learning about this, and I'm still learning, like they said, we like winging it. I'm learning as I go about all the benefits. But again, some women practice specifically to heal those, because you have a certain herb combination that you put together to heal those particular feminine issues that happen in our uterus, and it is working. We're seeing stories all together. I began doing vaginal steaming to bring awareness and to destigmatize the conversation around black women's sexuality, right? We are taught to, like I got red nail polish on, right? I turned 38 like 2 weeks ago, and I put on red nail polish. I was always told, don't wear red nail polish. No, loose women wear red nail polish. We're told all these things to control us, and our sexuality is no different. And I was meeting so many women in our 30s and older who say, I've never had an orgasm before. These things. I'm like, listen, we got to destigmatize this stuff and begin to talk about it. We're having babies and all of these things, and we're not talking about our reproductive health. Me personally, I began steaming as I began to learn about what uterine fatigue was and what it looks like, stagnation and the bleeding, like even the start of your cycle. Like if you notice that it's brown blood, even when your cycle is going off, you don't want that. You really want pink or bright red coming on. And I steam. I'm like, listen, I'm gonna see if this thing works. And I figured I was having some uterine fatigue, and literally it's worked. I steam once a week in when I'm not on my cycle, and I advise women to do that as well. So if you want more information or you live in Tallahassee and you want to be steamed, you can contact me. There are several other individuals in the city that do steaming, so I'm not the only person. Find who you're comfortable with. I believe that it should be a natural process. Like now, you see like these yoni steaming spas. It's not healthy to heat up plastic and to heat up all these materials that's going to go in your body. So I use 100% organic cedar wood, handcrafted boxes. I can travel to do a steam party of 4 or more, or you can come to my shop and we can do it. But it has great benefits. So look it up, yoni steaming. Dr. J
Oh,
may have medical terms.
that's awesome. Like you about to have me go and do a yoni steaming spa. But make sure it's organic. So the next one is, are there costs associated with having a doula? And are there patient advocates for pregnant women who feel like they're not being heard or unable to process the information being shared from the doctors? I don't know if that was loaded. I can.
It wasn't loaded.
Read that last part again, please.
The second question was, are there patient advocates for pregnant women who feel like they're not being heard or unable to process the information being shared from the doctors?
I'm gonna let Dr. J answer the last part, but as far as doulas, so insurance are really coming around and including doula services in their coverage. However, not every insurance cover doula, so the price of a doula will range, right? Depending on who you get. So I'm a donor international doula trained, and we believe that every woman deserves the right to have a doula. So we're affordable for those who can pay. We're affordable. If I come across a woman who wants a doula and she can't pay, I will be her doula. I will be her doula because I believe she deserves to have a doula even if she can't pay me. The Medicaid provider that pays for doulas, I know right now is Sunshine Health. They have doulas included in their prenatal coverage, but a range for a doula can cost you anywhere from 500 to 1,500 or up, depending on that doula, and that can be a lot of money for some people. But that's the price. And I said Dr. J could answer the patient advocate question.
I'm here. I'm in New York, and our Medicaid system just did a pilot study with doulas, where they're paying doulas now to come in for our Medicaid population. And we have managed Medicaid, so they're with every insurance company, which is excellent. And we just got 2 doula services now that have given us their services. So they'll come in on a sliding scale. They'll come in for free if a mom can't afford it. So they're telling us now that all of our moms are eligible for doulas. Unfortunately, COVID hit right when this happened. But several of them are able to do virtual they're kind of distance from the hospital, some of them, but they're willing to do it virtually. And the mothers even love that, that where they're there and the partner's in the room, but the doula's on the screen the whole time. But we're just praying for this COVID to go away so we can get back to normal. We're so excited. We have a lot of our patients do have doulas, but we're going to be able to offer that to everyone. I had a doula yesterday that came in with her patient to the prenatal care. She's been coming to her visits with her.
I just did my first virtual, I don't even know what to call it, doula, practice on virtual. It was so hard for me.
I know, you want to put your hands on.
Yeah, when she got in transition, and I was like trying to keep her in the space, like, listen, we're here, like, and I'm on camera and I'm trying to get her in a space. It's so weird because we use techniques, you're a midwife. Midwives should be midwives and doulas all together, but it was so difficult when she felt like she was losing it for her to pay attention to my voice to actually bring her back. Because for this mom, she didn't have a birth support person who was there with her who could listen to me and do what I was telling her. Because I met with her ahead of time to give her like some tools that she would need to help her, but she got just as nervous as mom did when she got in the room.
It's very hard right now. This is a hard time. It really is.
We have one more question in the chat. Are there any thoughts or advice on birth control options following pregnancy?
My thoughts on birth control is something that we should talk about, first of all, throughout the pregnancy, to give the mom time to think about it, to learn about it, to research it, so that by the time that she has the baby, she should have a pretty good idea of what she wants, and then we can decide at that point. I think the main thing with birth control, I call it life planning. That's a big part of my dissertation that I did. My doctoral dissertation was about contraceptive intent and future goal setting. I think that women really should be educated. I don't think that you should throw a birth control at them. You need to sit down, and that's a long conversation to see what their future plans are, their goals for pregnancy, future goals for career, education, and to teach them each different birth control so that they can choose something that fits their lifestyle and their goals. We have LARCs, which are long-acting reversible contraception. We have different ones. We have IUDs that are good from 5 years to 10 years. If you have someone that's getting ready to go to medical school, for instance, they say, Janet, put an IUD in, that gets me through college, pre-med, and medical school. That's awesome if that's a good one for them. Only person that can decide what's good for them is them, okay? Nobody else should choose what a mom should use for birth control. And I get that a lot where they'll come in and say, well, my mom said this isn't a good method, or this, different things like that. For instance, birth control pills. I hear people, they see this stuff on TV where they say somebody got a blood clot because they want birth control pills, the lawyers. I said, when you're pregnant, that is the highest risk time to get a blood clot, is when you're pregnant. So anything that prevents a pregnancy, that already decreases your risk of getting a blood clot, And you need to know exactly what the symptoms are that would let you know that there's a problem, and you come in immediately with any symptom. And the first thing you say in the emergency room on the way in is, I'm having whatever, and I'm on birth control pills. That way they know exactly what they're looking for. And so, we talk about the risk and benefits of every method, and they make their choice. And it depends, again, on their health history and that sort of thing also.
Yeah. And I just want to add a little personal touch to that. So I have 7 children, and my husband wanted 7 children. I wanted 0 kids. I was willing to compromise for 3. And I tell my own personal story because I think that women need to hear. We're empowered when we hear these stories. But I had also grown up in a family that I had never saw marriages work, right? So I figured I had to do everything my husband wanted in order to make my marriage work. And I was headed to law school when I got married, right? And we immediately started having kids. Is what he wanted. Then he asked me to stay at home, and the babies kept coming. And so for a really long time, I dealt with, I was having my own paradigm shifts of having so many babies. I'm a stay-at-home mom. I'm nursed and I'm pregnant. I got a toddler. It just was so much. And I wish that I had someone that said, what do you want to do? What is it that you want? And I would have said at that 3rd kid, if somebody had asked me, I'm done, right? And I love my kids, and I tell that story to my daughters, and I don't want them to feel like they were unwanted, but I want them to have power over their own bodies, and to understand that it's their choice. And if a man loves you, and I believe I know my husband loved me, he wasn't gonna leave me. You get 3, that's all you get, right? But we kept going to make him happy. And for us as women, we're talking about birth and all of this, our bodies is what goes through this, right? And so I was never able to tell postpartum from the depression, the regular depression of being at home and all of that stress for so long. I remember I nursed my last daughter till she was 3, and just all of that stress on the body. And so I Dr. J, you said it so well. What do you want? What are your career goals? What are your plans? My daughter wants to be a doctor. She's 13. She's not sexually active, but I talk to her now about contraception, and knowing that if you know you want to be a doctor and you know this what you want to do with no interruptions, this is how you have to protect yourself, if you begin to have sex. But I tell my story so many times because, again, great children, love them, but we have to think about the things we want to do. Because even now, being 38, where I should be settled in a career or whatever, I'm trying to find my footing because I stayed home 14 years with my children, so that was just great advice. And I wanted to share that just so women know, make your own decision. When I decided to do a birth control method after number 5, I got an IUD. I started having issues with the Paragard, and the copper started having some issues. So I had to remove the Paragard, and literally remove the Paragard. I immediately got pregnant, like immediately. got pregnant, waiting to, like, are we getting some tests and we gonna choose something else? And so after baby number 6, my husband like, oh, I don't believe in even numbers. We gotta have another one. So we had number 7. And when I was 5 months pregnant, I made him have a vasectomy. I'm not doing anything else. We're gonna stop this. And
Yeah.
so yeah, but that's empowering, Dr. J. So I wish I had someone like you in my life that would have said those things to me.
Well,
Yeah,
one
I
thing
can
I would
agree
like
with
to
that.
tell you, is it's never too late and things happen when it's supposed to happen. So whatever your career goals were back then, if it's still something that's on your mind, you still go for it. You go for it.
I think that was a big key factor when you said about your future. It's good to think about that because I know for me, a lot of people say, "Well, girl, you young, you fertile, you have a lot going on," but they don't know the inside story on my health. So it goes back to the beginning of our conversation when you say you have to advocate for yourself and you know your body the best. So
Right.
for a lot of people, just because it's a recommendation doesn't mean you have to go with it. Like Talethia says, she didn't take that, what is it you call it, baby break, the birthing break.
Right.
Me,
Right.
I'm right on the same path with you, Talethia. I had my
Mm-hmm.
twins October 2019. 10 months later, I have my son. So I have like, what is it? Irish triplets, basically. But
Yeah.
if I would have put myself on birth control, then my son probably wouldn't be here right now because I was on that birth control. But for me, after losing my twins, I just said, I still want my body to just be in detox from birth control. I've been on birth control for 3 years now. So, well, it was 2 at the time, but now 3. So I'm like, just let my body detox and I'll just leave it in the Lord's hand and let nature take its toll. So my husband and I just kept going on with life and I happened to spontaneously get pregnant again. And it's a blessing for me because I have this
Yeah.
baby here.
Yeah.
To me, I'm thinking maybe later on down the line, if I would have waited, then my son, maybe more complications could have happened for me. But for somebody else, like you're saying, if you want to be a lawyer, you want to be a doctor, you need that extra time. And you know that if you have a child, it might moderate your path, then do what's best for you. So
Right.
you want to have a baby after having one 8, 10 months ago, go ahead. That's you, it's your body. If you want to wait 3 years until you're 35, go ahead. But like I said, for me,
Exactly.
when I'm doctor saying your eggs are not maturing as fast as the other person, as other average women, and that your body is working harder, I started thinking about all the other conditions. Like, okay, so my body's working hard to produce a baby, but it's also working hard to maintain my life with the multiple sclerosis, the scleroderma. Who knows what the vitiligo can do? Even though it's skin, it's still taking away a lot of my energy. So I'm like, to me, I want to do this now and see if I can have a child. So I don't want to keep preventing that and then putting more medication on my body as well, because everybody's body don't take the same two medication, birth control. Some people say, oh, I was on Depo shot, I gained a lot of weight. I had the Nexplanon in the arm. That for
Mm-hmm.
me didn't work for a whole year. That was basically my birth control, spotting all year long. Some people have the pills, but they say, oh, I can't keep taking them. I miss them, or my appetite's different. So there's a lot that goes on with medication. So don't feel like because it's recommended that you have to go with that. But
Right.
also the future. I'm so glad you talked about the future.
Yes.
That was awesome. I mean, this conversation is just, I don't know. It's really touching because I also had a premature labor in 2009, and I wish I had a lot of advocates, when I was going through it. So this is all just, very touching for me. So, but let me get back into some questions. I have one in here to say, how soon into pregnancy should mom seek the assistance of a doula? And what should mom look for in a potential doula?
Okay, so we recommend moms to start. Um, it's to each his own. Some women, I got a positive pregnancy test. I want to begin interviewing doulas because it could be an interview process if you don't know your doula. But most moms begin looking for their doula in the second trimester, because there's a few meetings that we have in that third trimester to know, because it's a contract, right? It's a working agreement. And, I tell you when I'm on call or whatever. So I think that it's whatever makes a mom comfortable, but traditionally, moms begin looking for their doulas in that second trimester when they know, okay, pregnancy's going good, they're kind of feeling better. They could begin to think and prepare for delivery, what they want that to look like. And you have some moms that decide last minute, like, wait, I'm at the door and I'm so nervous. I think I'm gonna have to find someone who's gonna help me through this process. And they may choose, late, right at the end. But typically that second trimester, right at that beginning of that third trimester, so that you can get comfortable with your doula and you can begin to talk about what you want everything to look like in that labor and delivery room, and that doula can share with you what her responsibilities are, or will be to you during that time.
All right. We have a couple of more questions. So what are some of the negative impacts of birth control when it comes to women of color? And I know, Nay, you talked a little bit about that as well with the effects for you. And can anyone else elaborate more on that?
Are you talking about some of the adverse effects that different women have?
I'm gonna go with that. They just said negative impacts. So if the person who asked the question, if they want to elaborate a little bit more in the chat, that way we can get some clarity.
I'll start, and if they answer, that's fine.
So yeah, they said yes. That's exactly what they're looking for.
Basically, anything that you put in your body, you can have a side effect from it. Some people have a side effect, some don't. Some people that take the birth control pill, for instance, some women have nausea at the beginning when they first start taking it. They can have breast tenderness. They basically have the symptoms of an early pregnancy because the body is tricked into thinking that they're pregnant because of the hormone level. Most women that last maybe a week or two. Other women, it may last longer. So, and you'll have someone that gets no symptoms. So the person that has no symptoms, they're fine with it. But then you have another woman that says, I can't deal with this. So they come off, okay? So each woman has to know how she feels. And if she's having symptoms that she can't deal with, then she finds another birth control method. With Depo-Provera, which is injection, and with the Nexplanon that goes in the arm, the biggest complaint that we get from women is vaginal spotting in between periods. So you'll get your menses and then it'll go away, and a few days later you may have a little bit of spotting. That lasts for the first few months. It could last from 3 to 6 months. When we put them in postpartum now, a lot of mothers get it right after they have the baby, before they leave the hospital. It's working really well with them because they would have Talethia anyway. So it's kind of going along with the postpartum period. So by the time they're back to normal, they usually have no symptoms left. So they're tolerating it a lot better right after they're delivering. But again, each woman has to decide what she can tolerate or wants to tolerate or not. You have some women that are Jewish or some women that are Muslim who can't have that extra spotting because they can't be with their husbands with any kind of bleeding. So those women, they usually don't, once we tell them the side effects of the Nexplanon and the Depo, those are usually not methods that they would use because they can't really, have that. Some women use the birth control pill to regulate their period. If they're getting married, for instance, or they're going on vacation, they may go on the pill and do a continuous pill for 2 months to prevent their period from coming during a certain time. And that's fine too. So it depends again on each woman, it's the conversation. Like, what are you using this pill for? And if they'll explain it to us, and we'll tell them how to take it, and for their wedding or whatever. And so this is everything we do in midwifery care is a conversation back and forth.
I'm
that's
happy
all
to
the
hear
questions
about
in the chat.
that
Okay, go.
that Nexplanon. So that I didn't know that. So y'all read my bio. I got 9 children. One was dropped on my doorstep. Their mom had another one. Excuse me one second.
So while she is we get to see a baby.
Oh, let me see.
Oh, we have another question. So I'll let Talethia finish up, and then we have one more.
No, I didn't know that moms can get the Nexplanon right after birth. So we have a lot of women having babies. They got substance exposure, and they're out on the street and they're doing we call it prostitute, sex trafficking themselves, but they're having babies. I got 2 babies like that, and I didn't know the Nexplanon could be used right directly after birth. So I'm gonna definitely go in the hospital and advocate for that, because when this second baby was born, I asked the nurse, did she, counsel her on any contraception, and she had not, but she only offered Depo. So that's a whole nother conversation for another day, but yeah.
And she can have the IUD also after delivery. We put the IUD in post, as soon as the placenta comes out, we can put the IUD in. It has a higher risk of expulsion if you do it right after birth, because the cervix is still open. But if you have a mom that's not going to come back for her postpartum care, or that, has social problems and is not going to be able to come back, at least you're offering her birth control.
Sir Timmons, did we have any more questions?
I think it's one. So for any of the IUD contraceptives, do they use local anesthetic or for insertion?
In my office, I don't use it. If I have a mother if I have any difficulty putting it in, if it doesn't go in like butter, then I would bring her back and maybe give her some medicine to soften the cervix. But I usually don't have any problem. I usually give them some Motrin, and my mom go back to work after I put them in.
Okay, well, ladies, I just wanted to know, can you tell our viewers, your social media handle or platforms if they wanted to follow up with anything that was discussed tonight?
My website address is transitions with a S, womenshealth.net. And my Facebook page is, what is it? I'm gonna type it to you. Is that okay?
Yes, that's fine.
Yeah, and Dr. J, we'll also, if you can just tell our Z-Hope coordinator, Imani Lockworth, everyone will get the email with all the information.
Okay, I'll do that. I will do that. Can I just share one thing? I have a Facebook group, and I have 2 groups, matter of fact. I just wanted to say one thing is that when we talk about looking at maternal health and reducing mortality and everything, one of the biggest things that I think we have to look at is that we have to know that to increase the positive experiences for African American women, we've seen it's well documented that women who are cared for by linguistically, culturally similar providers do better and have healthier outcomes. So understanding and sharing our culture increases the likelihood that these women are going to have respectful, culturally sensitive care, medical, nursing, doula care, and we have to provide supportive environments to encourage women to ask questions, okay? And this can decrease the likelihood that babies are born too soon because they feel comfortable talking to us. And this is why it's so essential to increase the number of women of color entering careers in birth work, right? We need more Black doulas, more Black midwives, nurses, doctors, and we need to be part of the solution. So I have 2 Facebook groups that I'm gonna put the address also. One of them is, it's have you ever considered a career in birth work? And we're gonna be talking about different careers in birth work. And the other one is talking about birth stories. It's our birth stories. I think Black women need to convey our birth stories just like we're doing here to each other. I think it's a healing platform. I think that women come out of birth with transformation. They're transformed from delivering, proud of themselves, respect themselves so much more after delivery. They're so strong. And I think that those stories need to be shared, and our sisters need to be able to read those kind of stories, and the ones that haven't had kids, and hear the empowerment that we have. So we have to learn how to unmute, like I said. We have to learn how to goal set and plan for the future. And we have to follow our dreams. No matter how old we get or how young we are, we need to follow our dreams. And birth control can be a way to get to those dreams. So all of this kind of ties together, and it's individual. Each woman has to choose for herself what's important to her.
Yeah, I'm going to turn it back to the moderator. But before I do, I would like Nay to talk a little bit about, because I know I follow her and she's my sister, do my sister's keeper. You've been doing this great a new initiative of getting moms together. And I know it's something like Mom's Wine. I don't know if you could talk more about it.
Yeah, so she said, I just started a new virtual support system for women that are expecting to have children or who are already moms. Basically, it's a support group online. We meet every Sunday at 8 p.m. It's called Wine for Wine. So basically, you get your wine glass. If you don't drink, you bring the water. Today, I have some water, but and then we just debrief on life in general. You know, living in a pandemic right now, we are hindered from that facial, that interaction, that physical interaction right now. So the conversation that we typically have out when we're in school or at work with our coworkers, we're not having those conversations anymore. And so what I thought would be great is to bring this platform where moms or women who are going through this experience of trying to get pregnant and is trying to start a family can have a support system. So I opened this group up to everyone. I actually have girls in Philly, I have girls in St. Louis, LA, girls in Boston, Worcester. So we're all over the place and we're coming together to educate each other and also just to have fun. Like we're there for each other to just grow and evolve as one. So if you're interested in that, please DM me on Facebook or Instagram, and I can put you in contact with the link so you can join in. It is free. We also have, well, since it is new, this is the third session that I'll be having on Sunday, but there are also events in the works as well. We're going to do a paint night, so you could come. I will send out the materials, and the girls will be able to paint together, but we'll also be dialoguing. There'll be different topics. We'll talk about pregnancy. We'll talk about life in general. So it is open, and I recommend you to join in so you can also network with different women around the world.
All right. And I just want to, and this was a great panel, so I know we're going to wrap it up and give it back to the moderator. But I also want to shout out to Daphne and Emma, because they work a lot with the whole prenatal care as well. So I mean, we have ladies all from different states, and this is Black women right here doing Black maternal health. So I also want to say, because they are in Boston, I know Talethia, you in Tallahassee, I believe, or and then, we also have Dr. J in New York and Nay in Massachusetts. So this is almost a start of a directory here. So I just want to give that little quick shout out, but I'll turn it back to our moderator to close it out and, and then to go back to our chapter president. Thank you all.
All right, so I saw in the chat box that the panelists, they put their social media handles, so be sure to check it out. That way, if you have any follow-up questions from tonight, you can reach out to them. Dr. J, Nay, Talethia, I just want to thank you all so much. I feel like I'm leaving here so much more informed. I know the questions to ask when I do decide to embark on that. But before we go, Talethia, you said that your births were unmedicated, but you said that you were in labor for 3 days. Can you just give us, how did you get through that quickly?
Okay, quickly. Okay. So I decided that I wanted. So my first birth, my premature birth, was unmedicated. Still had 3 days of early labor. Believe it or not, kept getting injections. Dr. J, you know how they do it, giving me tributaline and all of this stuff to stop the labor. It didn't stop it, and I still ended up delivering the baby unmedicated. And so after that, I was like, if I could do this, once, I can do it again. It's a mind thing. Really, it's a really, really, really tough mind thing. It is the greatest thing I think I've ever done in my life. And it does take a lot of support. My husband, after the first, he was good, right? He was able to be really good support. But it is something where you go inside of yourself to draw on all the strength you have inside to say that I am capable of doing this, regardless of how much pain I'm in. And it's pain. And I tell women all the time, when they say, "Oh, it don't hurt that bad," no, it hurts. This is pain. This is the greatest pain you'll ever experience. But you have the power. God made us like so great that we're able to do all of that power. And so, I've had 7 unmedicated births, and I try to empower women to know that they too can have unmedicated births if they desire to have those unmedicated births. And you're not weak if you decide not to, right? I see people go into it and they want to do it in labor pain. They didn't expect it and they get a epidural and they feel really weak about that. But the body doing what it does is power in itself. That's the decision I made. And I think that we're all capable to make that decision, but not you're not any less stronger if you don't.
Okay, well, thank you so much again. I hope everyone, took away a lot from this conversation that's much needed, and everyone, needs to learn all about maternal care, whether you're an existing mom or a mom to be. So without further ado, I will turn you all back over to our chapter president. Once again, I was your moderator, and I hope you enjoyed the event. Thank you so much.
Thank
Thank you.
Thank you, everyone, for an incredible evening. This truly was eye-opening, inspiring, and life-changing. And for everyone that attended this evening, you will definitely get the information for our presenters. You'll be able to get their bios and the ability to get their contact information. We are beyond honored to have you all present with us this evening. I agree with a lot of our attendees. I wish that this was on a larger scale because the information that you all shared with us this evening was truly information that each and every one of our attendees needed to hear. Some of us have probably heard, but never quite understood, and it will forever change our lives. And I'm looking forward to, with your permission, hopefully share this with social media platforms because of the information that was shared this evening, especially during this season. I think it's pertinent that we do share it with the public on a larger scale. And I'm going to send that out to you all and just hope that it's okay to have that shared with the general public because I like Sora Timmons said, we've all been personally touched by this, and myself as a woman that has had a C-section, had fibroids issues, and now personally having to deal with the IUD and the issues with that, learning about how our health and our health as women of color are changed in this society and how we truly don't have a voice unless we advocate for ourselves. This is why this discussion was needed. On behalf of Zeta Phi Beta Sorority Incorporated, I thank you. On behalf of Omega Eta Zeta Chapter, I thank you. On behalf of the Divine Nine Swords that are present this evening, we thank you. Our community needed this discussion. The women in this chat needed this discussion. The families that are represented needed this discussion. And we are not just in the East Coast in Maryland and in Massachusetts, but we are in Vegas, California, in Tallahassee. We are truly covering the entire country with this conversation with the women that are present on this call, women and men that are present on this call this evening. And on behalf of all our attendees, we thank you. We appreciate you. I hope and pray each and every one of you are safe during this season. Continue to advocate for yourselves, advocate for your health, and share this information, this content that you received tonight with someone that you know that needs to hear. It is okay to unmute yourself, speak, and have your voice be heard. I love you all. God bless you all. Be safe and have an amazing evening. Good night.